You searched and NEI's experts answered. Here, NEI faculty answer the web's most searched questions on mental health concerns. I'm Dr. Andy Cutler, Chief Medical Officer of Neuroscience Education Institute, and with me here today is my good friend, Dr. Manpreet Singh. Manpreet, how are you?
I'm great, Andy. I'm ready to do this. How about you?
Me too.
Excellent. Should we get started with the first question?
Yes.
All right. If we were to autocorrect, does depression, fill in the blanks, make you tired?
Well, that is a good question. I would say so. That's one of the cardinal symptoms is fatigue.
Absolutely. I find it interesting, though, because depression can float either way, and some patients really experience excessive fatigue, and some just can't sleep at night. Now, you can imagine it's kind of like a vicious cycle, right? If you can't sleep at night,
That's right.
then you feel tired the next day and it catches up with you. But the energy and the sleep disturbance are both cardinal symptoms, as you said, of depression.
Absolutely. And there are many physical symptoms of depression, and one of them can be fatigue. Sometimes people mistake that for something else and think, well, I'm just stressed or haven't got enough sleep. So it's really important to get that checked out. One of the most common presenting complaints to primary care physicians is fatigue.
You bet. Okay, let's go with the next one.
You bet.
Does this depression make you lose weight?
Well, depression can absolutely affect your weight, but it can do so in one extreme or the other. So absolutely, some people with depression do have a decrease in appetite and can lose weight, but there's also a type called atypical, in which people sleep more and eat more and actually gain weight.
You're so much better than Dr. Google, Dr. Cutler. And I agree with you that, you have these, again, extremes between highs and lows, increases in appetite and decreases in appetite. It can definitely swing both ways. But one of the things that I think is really important to check out is what's a change from your baseline? Are you noticing not just changes in appetite, but also changes in weight? People tend to notice the weight changes, I think, more than their appetites because we're often in denial, aren't we?
That's true.
About what we're eating and what we're not. My husband will actually count his calories when he's kind of noticing that his weight is creeping up. Mm-hmm. And it's a surefire way to be able to pay attention. But I got to tell you, in our continuously plugged in world where we're finding ourselves increasingly trying to manage food rewards in an effective and balanced way, it can be very tough. So having an outside perspective, like a doctor, to provide you with some objective feedback about how you're doing in terms of your weight compared to baseline will be a very helpful way to know what to do next.
Yeah, and Manpreet, here again, just like with fatigue, depression can actually cause physical symptoms, and so you can be losing weight, and of course there are some medical causes of that. Yeah. So you definitely, if you're losing weight, you got to get that checked out. It could be depression, but it could also be a real medical, physical condition that would require other kinds of treatment.
You bet. All right, the next one is, does depression make you lazy?
That I understand that question because sometimes people think, well, I'm just being lazy, and family or friends might say, well, just get out of bed, get going, pull yourself up by your bootstraps. I don't think it makes you lazy. And the term, of course, is pejorative. But as we talked about, it can decrease not only your energy level, but importantly, your motivation, your drive, your feeling like expending energy is worth the reward or the result that I might get.
Exactly right. In today's world, we're increasingly finding our ways to decrease stigma around some of these things that we pass judgment on too quickly before realizing, for example, that something like low energy that other people perceive as being lazy may actually be a symptom of a bigger problem or something that might require medical attention. It's the unfortunate aspect of stigma that really prevents us from seeking the care we need in a timely fashion. So I know it's not easy to hear feedback from other people, especially if they're calling you lazy or they're biased or, being pejorative. But I think it's okay for us to maybe ask ourselves, well, is this really laziness? Are there other ways to understand what my energy is doing that's conveying that message to other people? And also appreciate the fact that we can be much less judgmental on others than we tend to be, right?
Well, speaking of that, Manpreet, I have to autocorrect myself. I realize I said a minute ago, real medical problem, as if this isn't a real medical problem. And we need to understand that depression is a real medical illness. It affects our brain, the brain is an organ like any other part of the body, and you can demonstrate abnormalities in brain structure and function and connectivity. And we know that medication can be very effective along with other things as well. And of course, the brain's connected to the body. So you have symptoms referable to the brain, but also you can have systemic symptoms.
Yeah. Critically important for us to really shed ourselves from the stigma and the judgments that we have and autocorrect in ways that actually will lead to better outcomes. The last thing we want to have happen is allow that term, that bias, that judgment to internalize and fester without seeking the appropriate care in a timely fashion. All right. Great autocorrection, Dr. Cutler.
Thank you.
The last one here for depression is, does depression make you forgetful?
Oh,
here's a good one.
I really like this question too, Manpreet. The answer is yes. Depression can affect your ability to concentrate and to remember things. We call this cognitive impairment. So it can affect how your brain functions, your thoughts, and your ability to perceive the environment, for instance. So yes, people often come to me and say, I'm having trouble remembering things. I think I have Alzheimer's or I have dementia. And it doesn't have to be dementia. It can certainly be depression. We're learning more and more about the importance of cognitive impairment in mood disorders in general. And we're starting to realize that some of our standard antidepressant treatments don't work as well. And so we're thinking about newer treatments that may improve the cognitive impairment.
You know, as I reflect on what patients come to see me for, it's usually the things that impair their day-to-day functioning. And being forgetful is another symptom, I would say, that people really pay attention to. If they're all of a sudden not remembering, or they're hearing feedback from others, well, I just said that, or didn't you remember, or whatever the case may be. Say, for example, in kids and adolescents, we see a lot of kids having declines in academic functioning. So their grades are dropping. And that's often a trigger to come see a doctor. So when kids and parents and adults come to me really worrying about their ability to function in their typical jobs in their school environments, that is definitely a red flag and one worth checking out. And it is something also that's somewhat difficult to treat if you don't have some resources in place. So if you try to flail on your own without appropriate support, it can be really tough, and then it perpetuates even more problems and struggles. So being not just aware of that symptom that you're experiencing of being forgetful, but also checking it out and having it tested if it needs to be formally evaluated. There are a number of ways that you can actually have it checked out. We've developed numbers of tools, cognitive tools, that help us understand not just for memory, like forgetfulness, but even other cognitive challenges like attention problems, trouble with executive functions, being able to, for example, find your way from one place to another. I suppose we have Google to thank for getting our directions straight these days.
Yes.
I don't even know if I remember my childhood phone numbers anymore, or friends' phone numbers in my phone book. So we're in a technologically very connected kind of modern world where we don't have to remember a lot of things, but the things that we do remember or need to remember, if they don't come to us in ways that they normally would, worth checking out.
Yeah. And I'm struck here by these questions. Depression is a constellation of symptoms, and it's not always obvious. It's not always depressed mood.
Right.
It can be all of these other things we're talking about. And so if you're worried about your memory, you're feeling more forgetful, depression should have other symptoms as well that go along with it. It's not just memory. But certainly it's reassuring to know that you might not have dementia, and it could be something that is very treatable. So I guess what we're saying is, if you have any of these symptoms, please don't be shy. Please speak to a healthcare professional, and please get help, because it is available. And it is a real medical illness, and it's nobody's fault, and you're not lazy.
Absolutely. Thanks, Andy. That was really fun.
Thank you, Nick.